Well, I can now check CT scan with contrast off of my bucket list. It's January 2nd. We're 2 days into the year, and yeah, CT scan was not how I anticipated starting my new year, but here we are. So the beginning of December, I started having some pain back here. It's kind of like this is where my bra is, and it's in between that area, and it feels like there should be a bruise there. It feels like I slammed into something, or somebody hit me with like a baseball bat or something. It's very tender, very sore. And I had my husband look at it because I've tried looking too, and there's no visible marks. Like the way it feels, there should be a bruise there, but there's nothing. And it's been there since the vow renewal, December 7th. So I was like, you know what? Let me call the oncologist and get it checked out. I do my best not to live in fear of reoccurrence of cancer, but I'm aware. I'm definitely aware. So when in doubt, if there's anything funky going on with your body, always ask your doctor first. It's better to be safe than sorry. So I did, and they scheduled me right away for a CT. They wanted me to check in at 11 so they could start like the contrast and stuff. They did use my port. She was nice, lovely lady. Obviously she knows what she's doing, but I feel like she doesn't deal with ports on a regular basis, because she had me laying down on the CT table when she tried to access my port, and she missed. Then she decided it'd be a better idea for me to sit up. So then gravity's pulling things away, and you can actually see, my port bump. So yeah, she had to stab me twice without any numbing, but second time she got it. And then we did the CT, which was crazy quick. I went in the machine, came out of the machine. They gave me the contrast. I think I went in, I came out, and then it was done. So it was like a lot of prep for not a lot of time to be in the actual machine. I've never had a CT with contrast before. I did like the CT for radiation simulation, but I've never done it with contrast. And I'm fortunate. I don't usually I've never had like allergic reactions or anything to like medications that I've been given in my 43 years, but that CT contrast. So she warned me that I'm going to get like a warm tingling sensation throughout my body. She said it's going to feel like you are using the restroom, but you're not. She was like, for some reason, it gives you a warm feeling everywhere, but especially in your groin area. And I was like, oh, cool, this ought to be fun. So I'm glad she warned me, because it did feel like I was pissing my pants as I'm laying on this table. Best way I can explain it, it felt like you had just rapid fire taken like 3 shots of alcohol on an empty stomach, like that quick. Suddenly my hands are warm and tingly, and then your whole body just feels like one big warm fuzzy, which wasn't bad. That was nice. But then I got nauseous, and I don't usually get nauseous. I made it through chemo 16 rounds without getting nauseous, but this injection made me nauseous. Thankfully, I didn't have to ask for a barf bag, but as I'm laying there and she's deaccessing my port, I can just feel my mouth filling with saliva, and I'm just swallowing it back and concentrating on my breathing, because I was like, dear Lord, please do not let me throw up in this room. And they had me wait for about 10 minutes in the waiting room, since it was my first time, just to make sure I didn't have any reactions. I did tell them I was nauseous, but I was feeling better. And then they checked on me and made sure I didn't have any like itchy rashes or hives or anything. Nope, just the sudden crazy nausea after the CT was done, because I had to stop eating before the CT. My blood sugar was low, so I'm being naughty. because I deserve it. I have immunotherapy on Thursday, so I'll see my oncologist then. The technician today said that it usually takes 2 to 3 days for results, so hopefully by the time I see my doctor, my results will be ready. Never a dull moment, right? Okay, before I let you go, I googled cancer spreading or metastatic, mets, and where my pain and tenderness is not listed as a common spot. So I am hopeful that it has some other logical explanation that is not related to cancer. So we shall see. Like I said, I try not to live my life in fear, but I am definitely aware. So yeah, I'll keep you guys updated. So, I love you guys. I'll talk to you later. Bye.